It started in, I think, 2015. I started having excruciating pain. I went to push a door open and this right here, I had this sharp pain. And then I could not even touch it like this. It was that painful. It was terrible. The doctor that I went to said that it was thoracic outlet syndrome. I was a chiropractor and then he did some movements and it didn't really help.
Ruth was originally diagnosed with thoracic outlet syndrome, which is a condition that compresses your artery, your vein, and your neurovascular bundle right along here or down here in the pec.
And then I went to another chiropractor. I went to an orthopedic surgeon. I got cortisone shots. I had surgery even. And nothing helped. When I called here, I was crying because I had so much pain and frustration from all these years. Like, try to reach for a glass in the cabinet. I was constantly using my right hand. I stopped really even using the left side from the pain.
So when Ruth came in for the exam, I had her reach her arm back and arm didn't go numb. I had her do a couple other provocative movements to rule in or rule out thoracic outlet syndrome, and they were all negative. So then the question really became, how are we going to diagnose Ruth accurately that explain her symptoms? And through some orthopedic testing and some ranges of motion and some palpation, we figured out that Ruth has a C8 disc degeneration, which is causing her symptoms and the part of her hand and forearm to go numb.
He said that I had adhesion in my neck, and that with treatment, he thought he could get me like 50% improvement.
So through treatment, we're able to unload or take pressure off of her disc, allowing the nerves and the disc to move correctly, or just taking pressure off of everything.
I felt hope. I felt hope that I could get some relief and not have to deal with this pain anymore. I was impressed with the office and the staff here is wonderful, and that the way that Dr. Joe explained, we're going to give you an actual diagnosis and tell you what it is, what's causing it, and how we can fix it. It's been great. I come in and, we do some measurements and see where I'm having some pain, and then, have the treatment. And, it's a little bit painful, but it's tolerable, and I'm amazed that I have so much relief.
And I'm happy to say that Ruth is now, I would say 95 to 99% better.
I have 100% improvement. It doesn't hurt at all.
She didn't need any type of invasive treatment. She just had to endure some discomfort while we were treating her neck and her pec area.
I don't even think about that anymore. I have to remember how it felt because I don't have any pain anymore. I'm in the maintenance plan and it was 3 months since my last treatment. I see people's stories talking about pain and I instantly always think, could Barefoot Rehab help them? Is that the kind of pain that they could help with? Anybody, back pain, neck pain, shoulder pain, it's amazing. This office feels like a family. Everyone's so welcoming. I've never had a doctor's office hug me. You guys are big huggers and really care about the person, not just my pain, but mentally, stress, depression, anything that goes on in your life. You guys really care about people. You want to help them.